So there are many things that someone can do as a hospice volunteer. And if you're interested in learning more about becoming a volunteer, you feel free to reach out to us, and that the phone number was there. Or at your local Mountain Valley Hospice. Like I said, we have several offices, and we will and can give you more information about volunteering. The reason that volunteers are so important is that hospice is the only medically mandated program that requires volunteers to maintain their certification. So for us to be certified in the area and be a hospice, we have to, it started out as a volunteer program, and we have to continue having volunteers. So as a hospice, our volunteers are priceless. But in addition, just like all nonprofits, to be a good stewards of the money that people put into trust with us, we must have them as well to meet our bottom line. It keeps us, just like all nonprofits, above that line. So if volunteering, that is not your cup of tea, or you just don't have time, lots of people don't, please keep us in mind when talking to and networking with your friends and family. You may know our next volunteer. Otherwise, please keep us in mind as you make your end of year donations. Like I said, we have 2 resale shops, one in Mount Airy and one in Sparta, where anyone can donate items from your closet. And all those proceeds stay right here in these 17 counties. And all the they're totally run by volunteers, and all the sales go to assist indigent patients and families. So those resale shops are very valuable in helping our families also. And like I said, donations ensure all eligible patients and their families receive the services they need. As your local independent nonprofit hospice, we rely on community support to sustain our mission and to provide high quality care to patients and their families when they need us. I've identified some ways that the community can assist us by providing one or more items, and we keep a running wish list on our website, and I will put that website out for you guys. On our wish list, we have we have a variety of things that you can do to help. The Waltz Hospice Home and the SECU homes, these centers serve as a home away from home for our hospice patients and their loved ones. They're a place they can go when they're too sick to be at home. They're also a place that they can go for respite, so that those caregivers can occasionally get a break. And like I said, there's a variety of wish items here that help us provide that best possible care while supporting our dedicated staff. And a few of these items we are currently in need of on this list are a UV cleaner. This is very expensive, but it helps us to optimize this infection prevention that we're dealing with right now with this COVID thing. It reduces staff cleaning time. We need large print Bibles to go into the different rooms, to the family areas. Fidget aprons, they help keep busy hands, something to focus on. Socks with grips on the bottom for adults is always good when you're talking about walking around in a hospital or facility. Keep your feet warm as well. DVDs for the theater room, individually wrapped snacks, bottled water. So as you can see, we have needs in all price ranges, and there are many other items on this wish list as well. And I would be glad to provide anyone a copy if they feel that they would, or they know someone that would be interested in donating or volunteering. All that information is on our website. Giving to Mountain Valley Hospice and Palliative Care allows us to continue our mission. Our mission is to help us create the best experience for every patient, every family, every time.
Don had mentioned whether hospice was covered by insurance, and you had mentioned that, and isn't also hospice services as well on the available on a need basis, so that people that are Medicare, Medicaid, or unable to pay can still receive services.
Right. We do not turn anyone away. We are a nonprofit, and that's part of what we do with our resale shops. Any family that for whatever reason does not qualify for Medicare or does not have insurance, there is no one that we turn away. We are 100% open to our community and anyone that needs or desires our services, be it as a patient or even as a community. We do bereavement for the community at large. You don't even ever have to be connected with us. Your patient could have, you may have had a family member die and you were never a patient.
Right.
If you want bereavement services, we will reach out to you.
Yeah. Don asked as well, what's your biggest need right now? If either locally here or what's the need that you're facing?
Yeah, well, with the COVID thing right now, we are really struggling with the volunteer situation. Medicare is not allowing, and we don't really want people to go into homes right now. But due to COVID, we've had a lot of people that have that are as comfortable with the idea of volunteering. So once that goes live, we have to have people trained and ready and on the ground so that once it goes live, we can start sending people out again. And then, as I said, that wish list, we always donations, because we are a nonprofit, donations to the resale store for the indigent patients. But the wish list items, and of course, just your patronage, to understand that we do serve a very large rural area, and when people come along beside of us, it's our bread and butter. We do not we do get reimbursement for people that do have insurance and Medicare or Medicaid, but a lot of times the reimbursement level is nothing compared to what the cost is.